Hi, everyone. Today's guest is Dr. Jonah Mink. He's the medical director at Healthy IO. Jonah completed his residency training in family medicine and community health at the University of Pennsylvania and works as a family doctor both in the United States and Israel. He cares deeply about health equity and social justice, and his expertise in new models of technology and relationship-based care delivery that address access gaps and improves the quality of care. He's passionate about new models of primary care that prioritize the right things for the right individual and the physician. During our discussion today, Jonah is going to enlighten us on how health plans can take data and convert them into actionable insights by leveraging focused chronic care service providers who enable care and diagnostics at the home. We also will cover how health plans are generating clinical results and revenue from these partnerships and provide guidance on how health plans should be thinking about partnerships of this nature. Finally, Jonah will talk about health equity and discuss how chronic care focused service providers like Teladoc Health's Livongo services or Cologuard or his organization, Healthy IO, or others can provide an important role in enabling health plans to reduce disparities in their community. I hope you enjoy this conversation with Dr. Jonah Mink. Greetings, everyone. This is Eric Laser, and welcome to our recording of Bright Spots in Healthcare, produced by Shared Purpose Connect. Each episode, we bring leaders together to not only inform our audience, but also unearth bright spots, successes at health plans, hospitals, and various healthcare-related organizations around this globe. Our goal is to identify as many bright spots as possible so that you, the listener, can determine if the ideas shared on our show can be applied at your organization. We believe this approach of finding a bright spot and cloning it is the most effective strategy to improve healthcare in our lifetime. Our topic today is true value-based care starts with action. And we will discuss this topic with none other than Dr. Jonah Mink, medical director at Healthy IO. Our sponsor today is none other than Healthy IO, one of Bright Spots in Healthcare's most prized partners in discussing value-based care and chronic care and last mile care. If you don't know about Healthy IO, you could check them out at healthy.io, but they are an innovative health organization that uses smartphone technology to make remote clinical testing possible. And I'll give you a little bit more detail about the organization later on in the show. Again, check them out at healthy.io. So Jonah, welcome to Bright Spots in Healthcare. And
thank you for having me. Pleasure to be here.
Yeah, pleasure. And you're a returner, very few returners. You came out on the show about a year ago. And so I'd like to start and let's talk about actionable, and let's talk about actionable approaches to population health. We all know about value-based care, but what do you mean by the term actionable?
Yeah, big topic, but I think it can be thought about kind of longitudinally. So for the last 10, 15 years, we've been reorienting or heading towards a new direction in healthcare in the US. It's been about data. It's been about insights derived from data. It's been about whoever has the best insights can potentially create the best value for their organization and for their members, for the patients. So health plans, health systems, physicians, everyone's capturing data about their population so that they can draw conclusions and insights about how to best address that population, how to improve their health, and thus how to save money, and how to kind of make the system work as efficiently as possible. What's interesting, though, what we're finding, or what we've seen, is that there's a lot of data being gathered, but the delivery channels for actually taking action on that data and changing the healthcare of people is going through the same traditional channels. It's the same clinical care team. It's the same methodology. So, for instance, a health plan may know that 10,000 of their members are prescribed metformin, but haven't filled a metformin prescription at the pharmacy in the last 3 months, for instance. What's the next step? What can they do? What they can do is they can fax the doctor a letter that says, please follow up with your patient. It looks like they haven't been taking their metformin. That's pretty much all they have. They don't have any way to actionably impact that patient's care, because rightfully so, it needs clinical oversight and needs consideration from the doctor, and needs to weigh that person's individual situation. But there are newer opportunities for partnership and kind of expanding the idea of team-based care outwardly towards population health that can really make an impactful difference in the way that we turn these population health insights into action. So for instance, let's say you have that clinical sign-off. Let's say that the bottleneck through the clinical team is more broad. Let's say that you have a very streamlined, very narrowly focused, but widely applicable interventions such as colon cancer screening, kidney testing, sugar testing for at-risk populations. You have a company that is all they do. They focus from the bottom up, from the top down. That is all they want to do, is reach people, motivate them to get checked, check them with their technology. So these technology-based companies are able to kind of remove that burden of that bottleneck from the clinical team, make it take that population health data and actually implement a screening or treatment service directly. And once you have that screening, you have those results, that's the time when you bring it back to the primary care doctor to continue the care for that person. So these new models are very interestingly changing how we think about team-based care, what care means, who the players on the team can be, and how health plans can really take an active role in being part of that team, which wasn't so obvious or even possible previously without these technology-focused, kind of siloed but focused and effective companies.
So just so we could level set on these providers, what are we going to call them? What's this category of organization you're referring to that health plans?
Yeah, I would say that they're really like focused service providers. So they are delivering they're technology enabled focused service providers. So they have a very solid understanding and capacity and capabilities for new technology that underlies reaching someone at home, for instance, having them self-check, remote monitoring, telemedicine enabled screening and or treatment. And they have the business and product capabilities to actually deliver that all the way to the end user.
For example, some company names that you would say fit in this category.
Yeah, so Cologuard is a great example. They took colon cancer screening, brought it directly to the person's home, a highly sensitive and specific colon cancer screening that someone can complete in their home instead of doing a colonoscopy as a screening exam. And the reason why that's important is that people don't want to do a colonoscopy. They don't want to go every however many years that's recommended for them and do a colon cancer a colonoscopy when they could do it at home and mail the kit back for a kind of a population health review. Everyone over a certain age needs colon cancer screening recommended by the USPSTF and all of the kind of general medical societies. And they can bring that to the home, right? So when they develop this proprietary technology that's very advanced, that is just as sensitive as a colonoscopy, and they're able to deliver that in a much more convenient, patient-oriented way, so that the patient can do it when it's comfortable for them and not have to come into the clinic, not do an uncomfortable test around other people. It changes the entire framework of how healthcare or how insights and patient level data and screening tests can be completed. Another one would be something like Livongo for monitoring and managing diabetes, or Healthy IO in chronic kidney disease.
And how are these, we'll call them focused service providers? You mentioned earlier a little bit when you're talking about how health plans can drive action. Let's talk a little bit about how these providers can be part of a health plan strategy to drive action, and the capabilities that they can be incorporated into a health plan's overall approach.
Yeah. So I think the health plan has such granular and incredible data about their members, and that's part of the work of an insurance company is understand the risk level in your population. So the more data that the health plans have, the more they're able to risk stratify and appropriately recommend, intervene, do the work that they do on their members, right? Um, the next level, the next step in terms of addressing that risk is focusing in on these conditions. So the end-to-end solutions start right after you have the data, right? So the solutions that Healthy IO provides, that Cologuard, that Livongo, et cetera, these service focused service providers can provide, is taking the data for a predefined population, at-risk population, and launching their service all the way from the patient engagement to for the product development initially, patient engagement, activation, meeting people where they are in their life flow, reaching that kind of last mile in terms of marketing. It's a weird word to use in healthcare, but people when are people going to respond to something you ask them to do? When they want to do it, when it's comfortable for them, when it's fun for them, right? So these companies are really focused on a consumer oriented delivery of a health test. And why that's important is because that at the end of the day, people will choose to do one thing or the other in any given moment. And if they're met when it's comfortable for them, if the companies are expert at knowing when it's good to ping someone on their phone to do a test, when they're most likely to do it, all of this data goes into these processes, and these businesses are built around kind of getting towards that last mile.
So
Once they, yeah, sorry.
I was going to say, so it sounds like they're almost become this action arm of the population-based screening initiative. So there's sort of they're part of a little bit of the clinical operations of population health team, but they're also part of the consumer engagement team that can enable both those departments in doing their job a little bit easier.
Exactly right. It's like those departments can almost turn on this function that then goes out and gets it done, gets that test, feeds it back as completed to the health plan. But not only that, they're going a step further and actually feeding the now actionable result from their test back to the patient's doctor, right? And now the doctor has somebody to work with. They can, instead of just chasing the person down saying, come, you need to come do your test, you need to come do your test, you need to come do your test. Patient doesn't come and do it. Now the test is done. Now they can take action on the results, right? And that's what makes this so interesting, is that it's an enabler for the primary care doctor, for the care team. And that's where this reimagining of the care team comes into play. You have the health plan, you have these focused service providers with good clinical oversight, right? These are run like the medical direction, kind of part of my role at Healthy IO is making sure that this fits in appropriately to medical care. And then once that's completed, sending it back to their on-site local clinical care team, PCP. It's really a pretty amazing loop that drives value for everyone.
So if I could, I'm going to summarize the components here. So you have, keep me honest, you have this product development. So it's for new technology where you have that in place. You have the clinical oversight, which you play that role at Healthy IO. You have engagement, and the way that a product, and let's say in particular Healthy IO's diagnostic, is engineered to drive behavior change and nudge at the right time. So you have that, and then you have sort of the activation where you could share those results so that the primary care doctor is enabled to go back and drive action with their patient.
Yeah, I think that's a great summary. I think the other thing I'd add is that after the patient is motivated to do the test, they do the test, right? And we can see it in the results. The adherence level to these tests is like leagues better than what it is baseline. They are also then further motivated to go seek care at their primary care doctor. So we're both feeding it to the primary care doctor, and any of these companies, right, are both feeding it to the primary care doctor, but also encouraging the patient. So we're encouraging them both to kind of converge and meet.
Great. Let's do this. I want to cover results and measurement because I'm sure that's what the audience is asking for as they're listening to this. And
Sure.
I also want to get into health equity too, because I think this is an important point. Before we do that, want to point out, because those of you who listen to the show regularly know that quite often, the format for this show are roundtables where I have multiple guests, and I almost always have a guest that is integrated into the conversation, representing a supporter or sponsor of Bright Spots in Healthcare. That's why we're able to provide you this show every week. A couple of times a year, maybe a few times a year, I like taking a leader at one of my partner companies and meet with them one-on-one and record the episode so that you could get a little bit more detail and in the weeds on their approach, where they sit in the ecosystem. We try not to make these conversations overly promotional. As you could tell, we're not talking specifically about Healthy IO, but I do think it does allow the market, all of you, to get a broader range of some of the solutions out there, some of the bright spots out there that you should consider bringing into your organization, whether it be Healthy IO or the overall approach to bringing in what we're calling these focused service providers to drive better last mile care and all the benefits that go with activation and action. I want, though, it is fair to get a little bit of a call out to Healthy IO, because they're doing exceptional things right now, not just in the US, but in Europe. They are the global leader in turning the smartphone camera into a clinical grade medical device for at-home urinalysis and digital wounds management. Their home urinalysis kits aid in the diagnosis of chronic kidney disease, urinary tract infections, and prenatal testing, and serves over 500,000 patients worldwide. Beyond being featured on CNBC and Fast Company and the Financial Times, Healthy IO is partnered with some of the nation's leading health plans and also the National Health Services in the UK, because of the test's ease of use, high patient adherence, and the huge potential savings. We're going to talk about that in just a moment. And they are the first company to convert your smartphone into a clinical grade medical device to enable home testing. So you should check them out at healthy.io. You can reach out to Jonah or someone, or reach out to me, and I will introduce you to folks there, just so you can pick their brain on how they could help you integrate actionable insights into your population health and consumer engagement efforts. All right, Jonah, let's talk more about results and measurement. How can health plans listening today measure the results that a Cologuard, a Livongo, a Healthy IO, and there's a bunch of others, just using those as quick examples? How can we measure these results? How does it impact their business?
Yeah, right. So any of these kind of new technologies, new services have to make sense financially to be implemented. In addition to their health benefits, it's important that they are sustainable. So what's so interesting about these companies, these tech-enabled companies, kind of as opposed to other kind of more legacy systems, is that you're getting real-time results, right? You're getting real-time feedback from the tests that are completed, because it's all digitally read. So you're having kind of a real-time feed, if enabled, to the health plan about exactly how many people are completing the test, the CPT codes associated, and what that allows you to do is close gaps in real time, right? You're actually closing the care gap because the person is getting the care. But for instance, with kidney disease, I'm most familiar with the HEDIS metrics. Are pointing towards appropriate kidney testing in patients with diabetes and others. And you're able to kind of real time close these gaps as the data is fed back. And it's kind of, with the levels of adherence that are enabled by these solutions, you can see major jumps in gap closure, which is really interesting. And so in addition to gap closure, the total cost of care for these patients after, as a result of receiving these tests based on, external actuarial models that I've seen that are done for the cost benefit analysis by a number of these companies, they show a relatively short term return on investment, which is incredible, right? To be able to have these models demonstrate that total cost of care shows a short-term return on investment, is, you know, which just builds over time, I think is kind of a no-brainer, right? If that it's worth the investment for all of these reasons.
And obviously, health plans are spending a lot of resources and time thinking about how to reduce health disparities in their communities and their markets. Health equity is a big deal, both from an altruistic standpoint, but for the overall health of their business. How is all of this tied to health equity?
Mhm. Yeah, I think one of the, as a family doctor, just in my experience, kind of clinically, and from what I'm reading and seeing, one of the major, obviously, health equity is multifactorial, but people's time in their day, where they spend their time, where they dedicate their energies, where they're able to free up time to think about certain things, most particularly their health can suffer if they're pressed for time, if they're pressed for money, if they're pressed for childcare resources, if they're pressed, right, in general. And one of the most interesting things about these, service, tech-enabled service providers is that they can really be flexible in terms of when they are done by the patient. So it's not like you have an appointment at the doctor, you have to take half a day off work, you have to show up, you have to go to the lab, you have to pee in a cup, which is uncomfortable, you have to do a colonoscopy, which is uncomfortable. There's so many reasons not to do all those things, and it's more pronounced the less resources you have to begin with. So when you're able to meet people as part of their life flow, they're able to dictate when they do this test. We're able to kind of understand their behavior through these, behavioral economics models and things like that, and prompt them when it would be most likely for them to do it. But really, they're in control. They're able to choose. They have agency. And a motto at Healthy IO is healthcare at the speed of life. So it's when they are ready to do it, when it fits into their life flow, they choose. And for that reason, it's a whole different model. And so no matter how pressed you are, you always have a little bit of time. It may not be when the traditional healthcare system wants you to do something, but it's when you're ready to do it. And when you're ready to do it, you do it. And that's why these home-based tests that are, enabled by technology, are prompted at the right times, are so critical and move the needle by so much.
The speed of life. I like that. Life flow. Really
Not
important.
my term, but I love it.
I like it. It's so true. I mean, we see it in businesses, right? Implementing new technologies and tools fail so often when you don't fit them into the operational workflow or clinical workflow, if you're talking about a hospital. And I think the same goes at a micro level when we're talking about an individual consumer. So that's smart.
Exactly.
I love that. Hey, let's in closing, how have you guys, or have you seen any published content around value-based care and action that may be interesting or valuable to our audience?
Interesting. So we wrote a white paper that we'd be happy to share, just kind of on this topic conceptually. I think that, it's talked about kind of what's the word I'm looking for? It's talked about kind of peripherally, but I haven't seen anything that kind of matches this idea of team-based care as including kind of an actionable arm of the health plan that is mutually supportive to the clinical team, and then bringing in industry. That kind of triad, I think, is very, very interesting. I think it's becoming more and more prevalent as after COVID, during COVID, everything kind of got a catapult forward in terms of at-home care, remote care. So it's becoming more understood, this type of positive trilateral interaction. But in terms of published content, I haven't yet seen it being reviewed. I think it will start to come, though, shortly. And I think the white paper, that we have would be a good place to start.
Okay, what we'll do is we'll put in the show description, wherever you're listening to this episode, Spotify, Apple, Google Play, wherever. We'll put a link to the Shared Purpose Connect website where you could quickly request. It'll link right to a form that you could request us to send you the white paper. And Jonah, you could get me that white paper, and we'll
Definitely.
ourselves to just quickly send it out to any listeners that want to review that. And how can people reach you directly? How could they find
Yeah,
you?
sure. Anytime, add my email address, jonah.mink@healthy.io. I trust you'll use it respectfully. But really, feel free to reach out anytime. I'm happy to keep talking about these topics. I love these topics. I think it's the future of medicine in general, of healthcare in general. So really, feel free to reach out, and I can connect you to the right place in our organization, other organizations that we work with. Yeah.
Right. And Mink, Mink.
That's right. Yeah. Jonah, JONAH.MINK@healthy.io.
It's great. Really appreciate it. This was a really good conversation, very enlightening, and you did a great job providing that overview without even over promoting healthy. I hope Donna and our friends over there in marketing are happy with that. But you did a great job. I appreciate it. Uh, Thanks everyone for listening. We always think it's a privilege. No, it's a privilege to capture your attention and time during our episodes. We don't take it. We take that responsibility very seriously, and we appreciate your support. So this is and has been your Bright Spots and Healthcare podcast.